Thank you very much, Jane, and thank you, Michael, for inviting me to speak this morning. And it is such a pleasure to work with Jane and in this industry, and the fact that there's such a full room here, I think speaks to the health and the opportunity in the STM world, which is what I want to talk about today. So I'm going to focus specifically on medical publishing, which I know is not everybody's area here, but I hope in doing that, I give you some ideas maybe you didn't have, or inspire you that your ideas are on the right track, and that's certainly my hope and my intention, that by the end of this, maybe you have some new insights. And in fact, I have some very fresh market data to share with you that I hope you will find as interesting as I do. So I'm going to start with a little bit of an overview of Wolters Kluwer Health and a little bit more about me, just to put this in context. I then want to talk about some of the data we've just gathered on our market and how our users are adopting digital devices and how the way they're accessing information is changing. I'm then going to dive a little bit deeper into how some of our customers are using our content in different use cases in terms of their day-to-day work. And then at the end, I'm going to try to pull that all together into what does that mean for us in the future. So we are part of Wolters Kluwer, which is about a €3.5 billion company based in Amsterdam, like every other big publisher in the world for some reason. And we have 4 divisions, all very much around highly educated professionals using information to get their work done. So Jane mentioned tax and accounting. I've also worked in legal. I've also worked in HR and health and safety. So I've had lots of different jobs around the publishing world dealing with books and journals and online platforms and software. My background is mainly marketing and product development. And as Jane said, I started with digital products. Actually, I started delivering CD-ROMs in 1993. And then, we got into the internet, and it's always been a fascination for me, actually, how technology can breathe new life into content. Now, Wolters Kluwer Health is about $1 billion, however many euros that is these days, in terms of annual revenue. And it's got 3 business units that all work very much together. So we've got our professional and education group, which is really about when nurses and doctors are in training. Our Lippincott brand is extremely well known globally, but especially in the US for its nursing education solutions. And then they have some practice aids that are used throughout the professional's career. Medical research, which is the business I run. Of course, students start reading journal articles, which we publish and distribute from the time they're students and are used throughout the career. We publish many society journals and some of our own under the Lippincott, Williams, and Wilkins brand. And then globally, we distribute that content, plus a lot of your content, on our Ovid platform in, 150 countries. So our products are used throughout the world, especially in hospitals and medical schools. Our clinical solutions group is probably most known for a product called UpToDate, which most of you may have heard of. Your doctor probably uses it no matter what country they're in. And what UpToDate is a synthesis of all the research coming out of peer-reviewed publishing to really be pulled together into how to assess, test for, diagnose, and treat various ailments. So that's so I think that the difference between clinical solutions and medical research is clinical solutions is really focused on the point of care. So in UpToDate, it's a doctor in and out in a few minutes, whereas medical research, you might be, in there quite a bit of depth. So that's a little bit about an overview of what we do. Let's talk a little bit about how digital is actually changing our industry. So obviously the pace of technology change varies quite a bit across industries. No question, it is massively changing how our customers in STM and how our personal lives are how we're adapting this over time. It's also no secret that the medical world's been a little bit slow to adopt technology, especially doctors. If you walk into your doctor's office, again, in just about any country, you're probably going to still see a lot of print journals and books on their desk and their shelves. But I am excited to say that is changing, and I'm going to share some data with you in a minute kind of shocks me even in terms of how much it has changed in the course of a year even. And I think that's creating some tremendous new opportunities for us, particularly the adoption of mobile devices, smartphones and tablets. We're now starting to see real demand for content that's more portable, for content that's more interactive and dynamic, using video, using images, being able to get access to the data and manipulate it. Being able to get the data when and how they need it on the device they're using at the time. And greater integration between devices and between different access points, whether an app or a website. So, this is creating some tremendous challenges and opportunities for us. I'm pleased to say Wolters Kluwer has been a little bit of a pioneer in terms of apps. We just launched our 200 and something-th app for our journals, and it's been fascinating to watch how these apps have been adopted over time, and also how the apps and how digital in general has changed the way that advertisers are working and interacting with clinicians. And advertising is a reasonably significant part of our business. I know it may not be all of yours, but I want to talk a little bit more about that in a minute, because I think some of what's working for them would work for other customers as well. So, what does this mean for us as publishers, these changes in habits? I think, first of all, we need to really look at responding to those needs, not just with the way we traditionally deliver journals and books, and of course, most of us are online now, but really starting to think beyond that to the content we have, the other assets we have or can create or acquire in terms of digital and video, and think about delivering information in a new way. But let's face it, you've got Android, and you've got iOS, and you've got the Google platform, and you've got all these internet startups doing all sorts of fascinating things. And as a CEO, not a day goes by when I don't have some employee telling me about some cool new thing that they've seen on the internet or that one of our competitors is doing. And I don't know about you, but I don't have endless resources or brain power to do it all. So I think the key is figuring out, well, where do you start? How do you focus? How do you tackle this huge challenge and opportunity out in the marketplace? And the obvious answer is get some data. Learn more about your end users and what they're doing and what kind of problems they have, and focus your efforts there. So one of the things that we do at Wolters Kluwer is a fair amount of customer research, and we have now started a tradition of every year looking at how our customers are using devices, what devices they're using, and how that's influencing actually how they interact with information. So we just have some very, very fresh data. We did a survey in late August, early September. We've just pulled the data together. You're the first people publicly to hear of it. And some of you heard me speak earlier this year at PSP about some of the data from last year, and there's some really, really big changes. We had about 12,000 responses from medical and nursing end users. About 70% were from the US and about 30% from other markets, so reasonably international sampling. And let's look at some of what they had to say. So one of the really exciting changes, though it means I have to spend more money on product development, is the iPhone is becoming less dominant. Now, Android's always been pretty popular outside of the US, but in the US, we really focused on iPhone apps because, especially for doctors, 70% or more of them had the iPhone. Other products were not being used as much. So you can see here, iPhone is losing some of its dominant share at the expense of Android. So our apps are all iPhone apps. We are now working on launching, sometime in the not too distant future, Android apps, because, that is a data-driven decision that says our market needs it. So, but fascinating that Android is really starting to gain share. You can see poor BlackBerry still, breathing a few breaths of life, but, the Crackberry comment is unfortunately long gone, and Windows quite low. Now, this is smartphones. I actually think Windows has some real potential with its tablet, especially if it can be used for business at some point, which I think it will. And then in terms of number of devices, it's been a 3-device world for a while. How many people here own at least 3 devices? Smartphone, laptop, desktop? About 4? I've got 4. I've got my Kindle. I brought 3 things to the book fair, lugging my big bag. And interestingly, personally, I didn't bring I brought my laptop, but not my tablet. So one of the challenges that we have is not everyone uses these things in the same way. As these devices are adopted, some people prefer the phone for certain things, some people prefer the tablet for certain things, but we're starting to tease out some of the big trends. So it's been a 3-device world for a while, but a couple of interesting developments. One is, if you looked at this data from last year, you'd see nurses significantly lagging doctors on phones and tablets. Well, they have massively caught up in a hurry. So that's something, if nurses are your constituents, you need to be aware of. The second thing is over 70%, and actually I think that's almost low given the number of hands here, over 70 or about 70% of our customers own 3 devices, right? And there's more about that I'll talk about in a minute that is significant for us in terms of an opportunity. But the other thing is having the device and actually using it in your work are 2 different things. And if you looked at this data a year ago, you would have seen that doctors might have a tablet, but most of them weren't actually using them in their work. But now 55% of our overall respondents are saying they're using the tablet at work. So tablets are becoming a lot more mainstream. Again, that's something we need to keep in mind in our planning. So this is also an interesting change in the data. So desktops and laptops still dominate, but look at this, half of the time that doctors and nurses are spending on devices is now with tablets and phones. And of course, they are people on the move. That's not necessarily surprising, but they really have started to embrace mobile in their day-to-day work. And that's a hugely important implication for us. You can see between nurses and physicians on the right-hand side of the slide, they're each spending about 3 hours a day on digital information, which for people on the move is actually kind of amazing. And you think of how do they do that? Well, I think the reason tablet and smartphone have started to become such a big portion is because they're in and out quickly. So this is creating new implications for how they're interacting with our content, and also new opportunity for really thinking about what are they trying to do then, because they're clearly in a hurry, they need to get something done efficiently, they need a quick answer. How can I help them? So we'll talk a little bit more about that in terms of the use cases in a minute. The other huge implication is very clearly the data says the more screens someone has, the more often they are interacting with content. This is a huge opportunity for us. It's a challenge in terms of thinking about how we deliver the content in a way to make that an easy, pleasant experience. But it is hugely valuable that the more we can get people to interact with the content, of course, the more they're going to value it, and the better all that is for us and the missions we're trying to accomplish. Now, I think last year there was some data showing that the amount of time they were spending with content was increasing. We didn't see growth this year, so they may have hit a bit of a plateau, but they're in and out, and I think the devices are driving that in terms of for different use cases, different devices, they're in and out for different things. Sometimes they're there for a long time doing research, and I'll talk a bit about that as well. But huge opportunities to engage our users. This, of course, is my favorite part of the research, because what is the number one place they want to look for new information about their specialty? It's the journal, and we publish journals. But what's amazingly different this year is last year you would have seen print at the top.
Test.
And I don't know where that came from. But now you see online. So I think we've actually reached a bit of a tipping point in our market where maybe they were a bit late, but boy, they are overachievers in terms of catching up. And digital is, starting to be the big priority. This is really interesting for someone who works with medical societies who still want to send a print journal to every one of their users, and actually advertisers, because most of the tracking on readership is still in print. We've got kind of an interesting challenge of some people with a foot very firmly concreted into the old world and the users really starting to push us pretty quickly into the new world. So kind of an interesting tension in the market, but of course where there's big change, there is opportunity. The data on the right is not recent, and some of you have seen this before. It's from a third party, but I think fascinating in the sense that about 10 years ago, people interacted regularly with 3 to 4 journals. I'm sure they never read them cover to cover, but maybe they browsed through them and flipped through them in print. But as of 2012, and I feel confident this would be similar today, people are interacting with more journals. They may be reviewing tables of contents or scanning more journals, but definitely our end users want broader information. So if you're someone who publishes one journal or a certain set of journals, and again, this is often a challenge to discuss with our medical society partners, our end users actually want to see everything in their area, or certainly a broader view of the specialty. So again, that creates both challenges and opportunities for us. So that's a little bit about the new way that people are interacting with content and the devices they're using. So, what does that mean to our key stakeholders, which of course include our end users, also authors? We want to attract the best authors to our journals and to our new product development. And in our case, advertisers, who also have seen their industry go through tremendous change and are looking for help in terms of how to get their message out into the market. So I've talked a bit about how mobile is changing the demand for all these people, and they also want more data in terms of how content is being used and what content is most important. So let me just give you an idea of a few of the things that we're doing, probably things many of you are doing, before I talk about some of the use cases and where I think this might be going in the future. So one is the integration of video and images into articles and other content to bring it to life. I will speak of a case study in a minute, but I will tell you right now, video massively increases the engagement that end users have with content. It's probably the most valuable thing that you could add to your content if you haven't already. The second is sharing. And you will see more and more, and again, many of you, I'm sure, do this. And Jane just talked about tweeting, the ability to easily email or tweet or post on Facebook or LinkedIn your article. And then another example is you're in an app and people want a dynamic experience, so the ability to link into the journal website, maybe to get archival information that might clutter up the app. So people are really looking for this seamless experience, and the more seamless we can make it, the more we drive up opportunities for that engagement with our users, which again is good for all of us. It's good for them, solves problems for them, and it's good for us as business people. And also, I would say, it increases the quality of engagement. Somebody reading a journal article and then being able to see a video or dive into the data is going to get so much more out of it than someone just reading a print journal article. So, I mentioned advertising as a case study to talk a bit about video. And advertisers look for reach, meaning who they're getting to their audience, exposure, who really saw their ad, but most important and what really sells products for them and gets information across is engagement. And in the digital world, engagement means swipes, clicks, and taps, actually interacting with the ad. And think about it, in a digital environment, there is just so much more you can do with an ad, right, and do with a message. So Wolters Kluwer saw an opportunity to go into digital because in the medical world, advertising has been decimated over the last decade or so by regulation and some changes in how pharma companies want to spend their money in terms of, in the US, going directly to consumers. So in some ways, it was a little bit of a move of, let's stop the decline, right? A little bit of a I don't want to say a desperation move, but a move of we got to try something different. We got to take some risks. So we decided to develop these apps and to introduce digital advertising, but we knew the market wasn't necessarily ready for it. So we created a bundle, raised our prices a bit, but we forced people to get this bundle. And what it was a tremendous opportunity for learning, both for us and for the advertisers. And what we found was when you add video, it increases the time that the end user spends with the ad by 50%, but increases the engagement, meaning how much, when it was just a flat ad on digital versus a video, it increases the engagement by 450%. And I suppose maybe unusually in the advertising world, doctors and nurses actually value ads because they want to know about that new drug or device that actually might help them improve care, or that they might, need to be using, within the next year or so. So, when you have a compelling ad, people really respond to it. And you think about the pharma companies, they can't send reps in anymore. You give somebody a coffee mug, now you have to track it and disclose it. And, this is certainly true in the US, but it's increasingly true in countries around Europe. And, there's certainly discussion in other parts of the world as well. So, video can really help get the message across. The other wonderful thing, but challenging thing about digital advertising is that you get data. Before you put the ad in the print journal, you mailed it out, and let's just assume everybody saw it. You do surveys on who saw the ad. Of course, orders that come in are the ultimate, or inquiries are the ultimate indicator of that, but it was a pretty blunt object. Now with video, you can see everything they did. How many people clicked and swiped and, who didn't, and, so it puts a lot of pressure on to make sure it's good. And one of the things we found in this joint learning environment was we've had to be an educator as much as anything. So first, seeing the opportunity of video advertising, and then you talk to these advertisers and pharma companies, they'd never done video before. So getting them to do the video. And the first videos were kind of like an ad on a video with a few little moving bits, but they've started to get quite sophisticated. And the some of the screenshots that have gone by here are a really great example, just some still shots from a video by a maker of a drug for multiple sclerosis. And what that ad does in a really fantastic way is it shows you kind of the problem as people have MS and they start to have mobility problems, and the impact that has on their ability to work and contribute to society and their quality of life, and how this drug can change that and change the actual impact on the patient's life. And in such a compelling way, it shows you the benefit that this drug can deliver. So video, massively powerful, and everything that it does for an advertiser, if you don't do advertising, or even if you do, it can also do for your end users, because they're the ones actually interacting with these ads so much and clearly getting value out of it. So video engages, absolutely. So now that we understand a bit about device preferences and the value of digital content, I wanted to dive in a little bit deeper into how clinicians are using content in the different things that they do every day. So what this is meant to show is we have content in lots of different forms. We have a lot of end users in terms of people who read the journal or use Ovid. And they're doing a lot of different things in each of these segments, right? They're keeping up with new developments. Sometimes they're doing deep research. They're treating patients. They're keeping up with their CE and CME learning requirements. And so my premise is we have to stop thinking about journals and books, even to some extent stop thinking about articles, but really think of ourselves as providing a combination of content, data assets, and technology in different ways to meet the needs of our customers. And the exciting thing is that all comes out of the content that we have in our journals and books, right? That's the base on which it builds, because having been in the digital industry for 20 plus years, I am firmly convinced content is king. That is ultimately what provides the value and what people are paying for. So that is the feature. But we have lots of end users doing lots of things, and there is so much opportunity to take that content and start to add value to it to actually solve these problems that our customers have every day. So let's talk a little bit about each of these areas. So, I'm sure, like me, you're a bit overwhelmed with just keeping up what's going on in our industry, but that's magnified for doctors and nurses. Just in the area of cardiology, on Ovid, we publish 2,000 new articles every month. Now, in your subspecialty, you're not going to read all of those, but even in your subspecialty, it's an overwhelming number. So how do people keep up with that? How can we help them keep up with all that? We're publishing them all, right? How can we add value to help them see what's new? And we do things today like table of contents alerts that they can sign up for. The institutional librarian might proactively set up for their constituents. I mentioned, emailing, sharing on Twitter or Facebook. How do we make that easy? There was another study we did earlier this year on nurses. Fascinating, 86% of nurses, I think this was US-based, 86% of nurses are using social media outside of work to track their profession. And that includes, referring to and reading articles, and 60% are using it at work. Social media depends on your customer segment, but it is starting to really get beyond that little logo you feel like you need to have on your advertising. And it's really starting to have some practical applications, certainly in our market. Of course, there are the traditional journal clubs and discussion groups that people use to keep up with things and also do some of their required learning. Video images, tremendously valuable for learning. And even videos from authors and journal editors to kind of help people figure out, in this collection of articles we've published this month, why should you read this one? Who should read this one? And in fact, one of our editors in our plastic surgery journal has really embraced this and makes sure there's at least one new video every month, and they are absolutely being used. Somebody I was talking to last night said they've been really helpful and actually a real attraction for getting authors to work with them in terms of feeling like this is a whizzy thing that they get to do if they work with this person's company. And then, of course, they need to read some articles to keep up with their specialties. So hopefully we can help them filter them down to read the ones that are most important. And that's also where apps come in. So we're now working on an app. We've got it soft launched that enables you to look at articles by specialty, not just one journal, but all the journals that might affect your specialty, and get those delivered to you proactively as the journals are published. So anything we can do to make the data discoverable, but also to curate it down to what's really important to people is hugely valuable. So in terms of research, doctors and nurses aren't going to be doing a lot of super in-depth research unless they're publishing. So I'm not going to talk so much about that. But it is interesting that research in the clinical space has a very direct connection into treatment and care. In some cases, in terms of changing guidelines, it could take 15 years, but actually, doctors and nurses reading journal articles, it does influence their behaviors to some extent, and sometimes helps them solve some really sticky problems, or unusual problems when they do the research. So they want to do things like check clinical trial data, and really try to understand, the data behind the findings. They need to keep up with commentary on guidelines, what might be changing, what might be questioned that they should be thinking about in their practice. And then something done a lot in the area of medical research is systematic reviews, which is really an in-depth literature search of all the evidence around a particular question, such as the effectiveness of a drug or a treatment, that hospitals and medical schools do and read extensively to really look for how guidelines should change and what is best practice. So features like being able to take content and integrate it into folders and save it for some of these bigger projects, alerts when something new comes up, in terms of their topic, save searches, so when they know they're looking at something over time, they don't have to rebuild the searches. And in our Ovid platform, people will have very sophisticated searches, maybe 2,000 lines, really, really, really sophisticated stuff. So the ability to, to really dive in and pull the data together is really valuable. Now, in the future, I think there's a lot more we can do. I know there's lots of discussion about metadata, the more we can tag content by specialty or subspecialty and relate it in different ways. I think there are just so many more opportunities in terms of how we can take that forward. And then in the point of care, that's the same people who might be doing deep research or publishing kind of need those quick answers. So there's up to date, but sometimes they want to see something that's not in up to date or maybe hasn't yet made it into a product like up to date. So they want more clinical information. They want, very simple searching. And in fact, book content can be really attractive in this kind of use case because it's the digested learning into, something that's more kind of how-to and best practice. In medical, there are big themes around evidence-based practice and evidence-based medicine. So the whole idea is using systematic reviews and using more kind of feedback loops within practice, figuring out what is the most effective treatment to create a better patient outcome. And governments love this because, in theory, if you're doing the best thing to get the best patient outcome, you're being more efficient, and it means you're spending less money possibly on the treatment, but very much so on not having people readmitted because you didn't get it right the first time. I think that's more of a theory at this point than a reality, but of tremendous interest across the world in terms of medical practitioners. So at the point of care, they're very much looking for this evidence of, what is the best practice. So, they want to check the evidence, their evidence summaries, there are these systematic reviews. They need to review clinical guidelines, which are usually issued by societies. Video and images can be used for diagnosis. So we just launched a product called Visible Body, which is virtual anatomy. It can be used for learning. It can be used for, just kind of putting things in context for a doctor in terms of how the different parts of the body work together. It can be used for patient education. We also distribute a product called Amersys, which was bought recently by Elsevier. We distribute it on Ovid, and it's radiology images and tremendously valuable for someone diagnosing. They have these expert images of things that might, be going on, in your body that not every doctor is going to recognize, and being able to see the image from an expert helps them, hopefully diagnose something quicker and start treating it quicker and making the patient better sooner. And then even patient information. So we actually just launched today a product called Ovid MD, which is on a different platform than Ovid, simpler, more clinically focused, a lot of books and tools and images and video, really meant to more go after this doctor use case. Now, a lot of this content was available on Ovid and still is, but it's really about delivering it in a new way, more suited to the needs of these particular end users. And then we also link from up-to-date to journal articles, and in some cases back the other way, again, to build this integration, really reflect the workflow of our end users. And then last but not least, I want to talk about clinical learning, which is the learning you have to do to keep up with your specialty. Increasingly, we're seeing medical societies not do certification for life. They're wanting doctors to recertify. Medical technology and research is changing so rapidly. They're really concerned that people are kind of losing, touch with what the best treatment is. So I know in Australia a couple years ago, they put in a massive new program around nursing education requirements in terms of nurses in practice. So they need to earn these credits and track them. Journal articles are a key part of that. We do CE around, reading the article and answering questions. And I think that image might show a, sort of hard to see from here, but a link into CE or CME that you can, directly, it's there and you can directly link in and make sure you have your CME. People want tools where they can save articles to read later that they can then submit for CE or CME. Again, videos and images extremely useful for learning, looking at a surgical procedure or seeing images of, diseased skin, let's say in dermatology, helps people learn and diagnose more effectively. I think too, as we take books and turn them into online products, you can actually turn them into something that doesn't even resemble the book. We have something called the Bates Guide to Examinations that started as a book in our professional and education group. And as they've turned it into an online product, you wouldn't recognize it. And you think about medical examination, how to do it, everything from interacting with the patient so they're comfortable to actually correctly assessing the various parts of the body and figuring out what might be wrong. That is so much better suited to video. And the video and images, it's an amazing product. And everyone who looks at it, this book's been around for a long time, they say, wow, look at this cool thing. It's like it's a whole new thing. So lots of opportunity as you move from print to digital and really take advantage of digital to meet the needs of end users. So what I wanted to do next is show you a brief video to just give you a little bit more idea of what research looks like in clinical practice and how much of a difference it can make. This is from a contest we ran last year promoting how librarians make a difference, because they are our main buyers and decision influencers, and help people gain access to our content. This lady here, sorry, it's always terrible when they catch video images, isn't it? It's like the worst expression possible. But her name's Christy Staggerwalt. She's the clinical medical librarian at the University of Missouri. I have to read this because it's such a mouthful. University of Missouri, Kansas City Health Sciences Library. And it's just a very, she's just sitting at a desk telling her story of how she used research to make a difference. So let's listen. To see people use our information to make such a difference. And of course, in medical, just almost comes with the territory, but also makes me good that she can't pronounce all that stuff either. It's all such a mouthful. But when you think about the librarians, they're kind of caught in the middle of this whole change. So you heard her, she's a librarian, but she goes on rounds. She's very involved in the, helping with the care of patients. And that's very much in one way how the role of the librarian is evolving, and they're called embedded librarians. They also support more complex searches and systematic reviews. They might work with a team of clinicians helping to, be the point person, gathering all the information, doing some of the more complex searching, helping to pull together the report. They influence how all the resources that come into the institution are used. If they have a hospital, whether it gets integrated with the electronic medical record, they have a portal that really influences, what's visible. They do training. They look at, rolling out apps. Will they roll out the app? Who they'll roll it out to? And generally educate patrons, whether students or doctors, in how to use the resources. And of course, doctors are tremendously smart people who do amazing things, but they cannot keep up with all the information. So I mentioned 2,000 cardiology articles published a month, and overall, not all on Ovid, there are about 2 million new peer-reviewed papers in medical published every year. It is a tremendous amount of information that's valuable, and sorting your way through that is really, there's huge value to be had in helping people to do this, and I think there is just so much more opportunity. Now, of course, librarians also track usage to figure out which content is, most used, and whether they agree with that or not, and either want to get other content more used or maybe push content out of the library. And they are often the decision maker on what's bought. Or certainly they are a strong influencer. I know in Scholarly Kitchen, I think it was last week, Mike Clark did a little piece on, what do you do with the fact that the journal market's fairly saturated and library budgets aren't going up that much? What do you do? And he talked a bit about going in to try to tap into other budgets, start to create new products, create more value to your products. And this is very much, along the lines of what we can do. And you hear she wants to make a difference. And the more we can help people like Christy make a difference, people find the money. And the more of a difference we make in medical, which of course is good for all of us. So what have we learned as Wolters Kluwer from the research we've been doing, and how we've been actually trying to deliver that in terms of enhancements to our customers? Overall, we're really, as I recommended to you, shifting our focus from products, journals, and books more to solutions. What problem are we trying to solve for the end user? How can we help them be more effective and efficient? And using the knowledge and fantastic content that we are lucky to have. And some of the key themes for us are looking at our different end users. As you think back to that slide I had a few minutes ago around, doctors and nurses and medical researchers and pharmaceutical companies. We have lots of different end users, and each one of them is doing different things with the content at different times. And of course, each one of them is increasingly using different devices for accessing, that information at different times. So we're really trying to identify our end users and understand what it is they're trying to accomplish. We're trying to focus more on workflow, sharing, and productivity tools. So how do you take the information and put it more into action for them? We are investing in data analytics. And in this case, I don't mean clinical research data. I mean data we look at in terms of how people are using our content, how often, which content, who's using it, how much are they spending? What segment are they in? And that's been really, really helpful, again, to help us figure out where to focus our resources, to add the most value. We've been focusing, as I mentioned, on integration and linking across different systems, whether from app to web or from journal website to Ovid. And we've been looking at different business models and revenue channels. So in the pharma area, we have the ability for people to do pay-per-view on documents. We don't find that's as effective in some other segments. Advertising, of course, is a particular area that we've been quite successful in due to really committing to digital early, and we see much more opportunity there. And I mentioned, for example, our new Ovid MD product. So lots of different opportunities already. So where do we think that's going? I want to show you another video, and this one's a little bit goofy. It's off of YouTube, but I think it does create a little bit of a thought-provoking idea. So let's listen. Thought that video was a little bit goofy because did you notice how many times they used the hand sanitizer? I don't know maybe they were sponsoring it. But we decided to include it because I think it really starts to, you hear about Google Glass and you're like, oh, really? Would people wear those? And, I'm not wearing wearable technology till it has diamonds on it. But, you can really see how it can make a difference in the world of medical and has a practical use. And in fact, I laugh about wearable technology, but who here has a Fitbit? I just got one a month ago, and I'm addicted to it. And what the Fitbit does, if you're not familiar, is it tracks all sorts of things, but mainly how many steps you take. And its goal is for you to take 10,000 steps a day, which is walking about 5 miles. And you really want to do it. You don't want to disappoint your Fitbit. It has like a little smiley face on it, and it feeds into your computer automatically. You have to do nothing. It sends you little emails motivating you. And it's like my new friend. But it is really it's the wearable technology that gives you data. And actually, the future, it doesn't seem that strange, right? These things are out there now, these watches, these Google Glasses. And in fact, in our clinical solutions group, they are just beta testing a product around helping hospitals treat patients with sepsis, which is an infection that can kill you within hours. And it does kill many, many people, around the world every year. And the problem is, it is about monitoring temperature and other vital signs and catching it soon enough before it starts to very quickly spiral out of control. And the product very much focuses on data we gather through some of our electronic systems in hospitals and an app that the nurses have that will alert them, force them to track and monitor these vital signs. At a certain point, start some additional intervention, including informing the doctor. It is a big culture change, I will tell you this, these alerts and needing to bother the doctor, which they don't want to do. Some very interesting cultural challenges as this product kind of works its way out in terms of its beta test, but tremendously powerful when you think about what mobile technology can combine with information could do. This could save huge numbers of lives, if it works as planned. So, the future, really is out there now for us. So, and then when you think about just all of the opportunities around technology, how it continues to change, and all the great content that researchers in all of our fields continue to create. Personally, I'm a marketing person, right? I would say the possibilities are endless. That might be a little bit dramatic, but they are certainly very numerous. There are so many more ways we can add value to our end users by combining content and technology. So, to sum it up, I think there is opportunity, many, many possibilities in a market that in some ways you could look at and say is pretty mature. And I will tell you, having worked in tax returns are a commodity, accounting firms are consolidating, they're all getting older, that's mature. In legal, the industry is really changing. Certain specialties are now, handled on the internet or over the phone by internet companies. That's really changing. I don't think there's an industry out there that you can't look at and kind of find depressing, but I think it's because they're all changing. And it's really that change that brings the opportunity, and it's about thinking, in terms of a new model. But at the same time, not forgetting that it all comes out of the fantastic stuff we already have and the content that we already produce. So first thing is opportunity. Second thing is, how do you figure out what that opportunity is and focus on it? It's about learning. Really trying to understand your customers through surveys, through observation, through your products, gathering data from usage of your products. So, learning about your users, your different segments, where can you drive the most value, who's got, the most money to invest in things that, would actually drive more value. And then last but not least, as I started out by saying, you can't do it all. Nobody can. Even if you did have endless money, and I don't think any of us do, you've only got so much brain power in your organization. You really do have to focus. So use that data to prioritize. And something we do that I learned from an outside consultant who spoke for us a few years ago is we think about 75 or 80% of our time being spent on achieving our current goals and running our business as is. And then we think of the other 20 to 25% as having a constant stream of new experiments, of things we start in a small way, and then when they work, we invest more in them. And in the couple of years I've been with medical research, that's worked really successfully for us. And again, it keeps employees excited. And I've mentioned before, I think part of why we need to do this is we want to attract really smart people with long careers ahead of them, and you do that by doing cool stuff that makes a difference. And so for that reason as well, we need to do this to keep our industry vital and relevant. I think, Michael, what is the journal coming up on? It's 250th year or something? 350th year, right? So journals have been around for a while, but we want them to be, even more vital and important in the next 100 years. So, I think all of these things contribute to that. So, I hope that maybe I've told you something you didn't know. That data, I hope, was interesting and inspiring to you. I hope if you knew all this already, that maybe I reinforced your views or re-energized you around what you're already doing. I would love to hear back some of what you're doing, some of your ideas. I'm sure I didn't cover everything. Or if you have questions, let's have a little bit of a discussion. We certainly got a little bit of time. Jane, yeah? Yeah? So who's got the first question? Yep.
Could you introduce yourselves when you ask a question? We have some roving microphones around.
Good morning.
Morning.
I'm from Brazil. I'm a release. I'm a medical publisher. And I think this is amazing. We always are trying to do. And my question is, how do you keep up with technology? Do you develop inside the technology? How do you keep up with the technology? And the other question is, the updates, do you have an in-house team of doctors? How do you pay them? 2 questions.
Okay.
Thank you.
So first question, how do we keep up with technology? I think that is a huge challenge, and I personally struggle, and I think many people struggle with how much should you track the latest technology or the latest thing going on the internet. I find it all a little bit overwhelming, and the way I keep myself sane is by first focusing mostly on the customer and what's going on with them. Because a new technology that works well in one market might eventually affect our customers, but it might not. So I keep my ears open to the technology, but I focus much more on the customers and what kind of problems they're having in their day-to-day work. And if I can figure out what problem I'm trying to solve for them, then it's a lot easier to narrow down the technology that might help me solve that problem. So that's how I deal with it, but I agree, it's changing so quickly and there's so much happening on the internet. It's a little bit scary. You just worry about someone coming in from left field and completely changing your business, and I think that is something that keeps many people up at night, but that's how I deal with it. So the other question is, do we have doctors on staff? We do. We have quite a few of them on staff, mostly in our clinical solutions business, and they are actually required to, well, some of them, they're qualified as doctors, but they have different jobs. But the ones who are sort of hired for their knowledge, they're actually required to practice part-time, and we allow them for that, in how we compensate them and how we work out their hours. I don't know if you could do that in every country, but this is, in the U.S. And also because we've talked about actually bringing some into medical research. We have nurses, a number of very, very qualified nurses, but not doctors today. And I know one of their best practices is bring people in first as a contractor and really see if it works, and then bring them on full time, because not everybody can make that transition from doctor to someone who works for a publisher. And they really learn the hard way, kind of to try it out on both sides before you make it permanent.
I think we had some more here.
Anthony Watkinson, Cyber Research. Let's assume that a hospital clinician searching PubMed, Google Scholar, comes in, hits a site, journal site. What do they find when they look at the journal, which will mean that they can tell quickly whether it's worth their while wading through the research stuff to find out it's actually applicable to their practice?
So the question is, if you come into the journal from another site like Google, how do you know if it's relevant? I mean, there is an abstract. I think there's a lot more, frankly, we could do there, to immediately make available maybe a video. Also, I think the more we can proactively curate and deliver, knowing who the end users are, the list of articles that came out and why they might be relevant. We shouldn't make them have to search Google to figure out what's relevant. That's always going to be part of what they do in some cases. But, certainly I think, today they see the abstract, but there's more we could do there, absolutely.
Janice, there was one over here.
Hi, Phil Jones from Digital Science. It was a great talk, thanks very much. It's great to see Wolters Kluwer kind of getting hip deep into end user needs to show market leadership and actually solve the problems. So I'm particularly interested in things like UpToDate, where you have provided tools that are innovative and new ways of kind of aggregating information. And I wonder if there are lessons for society publishers here. Perhaps there are ways that society publishers can provide tools to their practitioners and their members, which are field-specific or subject-specific in similar kinds of ways.
Yeah, I mean, that's a great point. So UpToDate really takes the journal articles, and they have something like 5,000 doctors who contribute to their content by specialty, and they review all that. They basically do, read systematic reviews, do their own research, and then synthesize it into this very standard format. So whether you're looking at, cardiology or dermatology, you're going to be looking at a very similar type of layout and treatment of whatever, the medical issue is. So they've really taken the information one step further and digested it for the end user. And, it's interesting. I mean, the average time in and out of UpToDate is about 2 minutes because it isn't generally the stuff they know. It's not their specialty. It's maybe something a little unusual, or maybe the bit they don't know that's interacting with, whatever their specialty is. It's a tremendously, tremendously valuable product. And I know lots of people are working to compete with it, but no, in the end, it took them a lot of time and years and money to actually build this, and I think that's partly why no one's caught up yet. They kind of try to do it by aggregating different things or clever searching, but in the end, what it is people have really, really digested and standardized this information into something you can very quickly implement. And absolutely, it's a totally different kind of, it's content creation in a totally different way. And very much end user driven, but I think absolutely an inspiration for other applications, but quite expensive to build and maintain.
There's another question just here.
Thank you, Cathy. Tony Derniak from IEEE. In the United States, we don't have socialized healthcare like we have here in Europe yet, but we do have Medicare. And Medicare is mandated, as you know, that all physicians and hospitals go to electronic record keeping. To what degree do you think that skewed the results of this survey in terms of the use of electronic devices?
Yeah, that's a great question. I'm sure it has, because if you go to a doctor or a hospital in the US today, in doctors' offices, you will see people carrying around a tablet or a tablet-like device that's particularly, designed for their medical system. If you go into the hospital, it drives you crazy because you tell, 5 people the same thing, and they keep putting it in the record, and it's like no one read what was in there already. But they are in and out of that computer constantly, and I'm sure that has helped to accelerate adoption. So the Affordable Care Act passed a few years ago has given hospitals a strong incentive to invest in technology. Definitely helps us with our clinical solutions products, no doubt. And I'm sure has helped to accelerate adoption, in a market that was pretty slow to adopt technology. I think that's a great point.
Any more questions? Oh, one more here at the front. Janice?
Hi, Rahul from MPS, Portland, Oregon. I have a couple of questions. Firstly, congratulations on your digital strategy for MR. My first question is on the reader side. As you scale up, how do you plan on balancing content with advertising? When does content actually turn into clutter when you increase advertising? And my second question is on the advertiser side. In the early stages, since advertisers are hungry for data, how were you able to sort of educate them without any benchmarks or data available?
So yes, so the first question is how do we balance not making advertising too invasive? Always a difficult question when we talk about a lot. We have today limited it to our print journals and our apps and our online customized journal sites with the societies where some like it, some want nothing to do with it. So we kind of have to honor their preference. Ovid, we feel, because it is used for this very in-depth research by the same librarians who influence buying decisions, that's one we've always been very hesitant to touch with advertising. That screen space is too valuable. Our users, are pretty conservative. So probably won't touch that anytime soon, but we are looking at some of these other interactions, other mobile applications where, we think there's opportunity to deliver advertising. And particularly, like I said, the end users, the doctors and nurses value it. So if we can put it there in a non-irritating way, it actually adds value for them. And then, how do we influence advertisers? I mean, part of it is just getting a few to go along with us to gather data, might give them some favorable pricing. We work a lot with them. We're a little bit ahead, of them in terms of really focusing on this market and working with lots of people, but we're learning too, so we really work very closely with them. As I said, we almost are as much an educator and a consultant as we are a provider of advertising services, but we found, although that's some additional, investment in terms of talent and time spent for our employees, it pays off in terms of the learning, that's driving us forward. And certainly in other areas as we ramp up, Jane is building a whole team around, getting closer to our customers. So it is an investment, but I would argue it pays off. And that's really how you get past the benchmark before you have it, in my view.
Thank you, Cathy, for a great start to our conference. And we're now going to take a refreshment break. Please come back here at 11 to the social media session. Thank you.
Thank you.